Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning. Welcome to Open Your Eyes.
Start your morning right.
I'm Marlene Cuellar.
And I'm Gavin Courtney.
And thank you for joining us this morning.
It's a beautiful Tuesday morning here.
That's right.
Although I'm seeing a little bit of rain clouds, so.
There was a bit of a sprinkle, and of course we're going to get the latest on the weather from our forecasters at the Met.
Yep, and we've got Angelia Guy on the line this morning. Good morning.
Good morning.
How are you doing?
I'm good, and you?
I'm doing pretty well. Let's get into our weather update for today. So what kind of general situation are we seeing?
Okay, we have relatively drier conditions moving in over the area. So we're expecting generally fair weather to prevail today, at least for the next 36 hours.
So we're going to get a little bit of an ease up from the rain?
Yes, we will.
All right, that's great news. And what about over the next 24 hours?
Okay, we expect skies to be sunny with a few cloudy spells today, and then partly cloudy to cloudy at times tonight. And we expect only isolated showers or thunderstorms to develop.
Okay. What about our winds?
Okay, winds will be generally from the northeast at 5 to 15 knots.
Okay, and let's get into our temperatures. How hot is it going to get today?
Okay, temperatures will continue generally mild, reaching about 84 degrees Fahrenheit along the coast, 86 inland, and 76 in the hills.
And tonight?
Tonight, the low temperatures will range from 76 degrees Fahrenheit along the coast, 72 inland, and 64 in the hills, so still on the cooler side.
Okay. Can you tell us about our outlook for the next few days?
Yeah, well, like I said, generally fair weather will prevail for the next 36 hours. So for tomorrow, we're expecting isolated showers or thunderstorms, and then an increase Wednesday night and Thursday to have a few showers and thunderstorms to occur mostly over central and southern areas of the country.
Okay. And are we looking at anything in the Caribbean or any sort of weather systems that might be watching for a tropical weather outlook?
Not at this time.
Okay. And even though you said we might get a little bit of an ease up with the rain, do we still have any advisories or watches in place?
Yes, we still have a flood warning that remains in effect for low-lying and flood-prone areas as the waters continue to move downstream, especially from the Cayo area.
Okay, so we'll be monitoring that situation. But until then, Angelia, thank you so much for giving us that update.
You're welcome.
All right, and we hope you have a great day.
Thank you.
Bye.
Bye.
Okay, so we are supposed to get some sun today.
I know, right? Finally.
I know. People have been really looking forward to some of a break, and that's exactly what it's going to be because we do expect more showers. I think they said on Thursday, right? Wednesday to Thursday, yeah. So definitely, you have laundry piling up. This is a good day to do it. Get it out there so you can at least know you got that done before we get more rains again.
Absolutely. And of course, do be advised to be as prepared as possible if you live in a low-lying or flood-prone area. There could be a risk from these excessive waters coming down through the country. We were talking just now about how high the Belize River is looking, like on the way to Ladyville, which is near where I live. So please do keep a lookout.
Yeah, and you know, we know that a lot of places are still facing floods. We do want to remind you that you have to take your health into consideration as well. Do remember that the flood water itself is very contaminated. Make sure you clean If you have to walk through it, you clean up properly afterwards. Don't consume it. You can boil the water. You can use the tabs or Clorox to be able to purify your water once again. So please just be safe, because you don't want to have to deal with sickness afterwards as well. And remember that the Red Cross still has their appeal going for assistance for persons who have been affected by the flood. And you can go to their Facebook page to find out more. We're going to keep things moving this morning with our eye opener. And our eye opener, taken from dailyom.com, goes like this. When we begin to listen with our hearts rather than our heads, our whole world changes and becomes softer. Most of us were born and raised in cultures that value the head over the heart. And as a result, we place our own hearts below our heads in a sort of inner hierarchy of which we may not be conscious. What this means is that we tend to listen and respond from the neck up, often leaving the rest of our bodies with little or no say in most matters. This is a physical habit, which sometimes feels as ingrained as the way we breathe or walk. However, with effort and awareness, we can shift the energy into our hearts, listening and responding from a much deeper, more resonant place. For a simple start, try sitting with a friend and asking him to tell you about his life at this moment. For 10 minutes or more, try to listen without responding verbally, offering suggestions or brainstorming solutions. When you do this, you may find that it's much more difficult to offer advice and much easier to identify with the feelings your friend is sharing. You may also find that your friend opens up more, goes deeper, and feels he has really been heard. If you also feel great warmth and compassion, almost as if you were seeing your friend for the first time, then you will know that you have begun to tap the power of listening with your heart.
I really do like that eye opener, and I'm smiling because the second half of it really it reminds me of a conversation that I was having with some friends very recently about giving advice, and basically to friends or whoever when they're in need, or especially when they're going through something difficult. And we were talking about this in the context of relationships, and basically we were the reason why it's funny is because we were joking and we were coming to the conclusion that basically your friends, they never really want to hear your advice, and 9 times out of 10 I'm sure you've had people and even if you do tell them, they don't follow it, especially if it's relationship advice. Because the joke was that because 9 times out of 10 when people are coming to you with a problem, it isn't necessarily because they want to find out a solution from you. It's because they want some support, and they want to feel understood, and all those things in that sort of a situation, or at least that's the most important thing, rather than focusing on the solution. Because I mean, even when you're going through an issue, you're probably thinking in your head about you've probably thought about many solutions, but it's hard to do it because you maybe need that extra push, or you need to feel that extra support to give you that confidence to take the next step or what it is. And that's why we often end up coming to others or leading on others. So definitely we can learn from this eye opener in terms of listening with your heart, and responding sort of naturally, and responding to the feelings rather than making judgments, and thinking about what's the best way forward, or thinking about it with just reference to logic, because we ignore what a lot of the fundamental issues are when we do it like that. And then we also, even if we can move forward, stuff is still sort of underlying or unaddressed, and it's because we haven't really processed the feelings and how it would make us feel, or how we're feeling now, and how we want to feel, and how do we get there, rather than just thinking about it from a purely logical perspective.
Yeah. No, it's a very interesting eye-opener, and I think that it's one that we can all identify with. Actually, it took me back to a conversation we had with Jenny at one point, and there are also some really interesting gender lines here as well, and I think we usually see it in our relationship dynamics. Women especially tend to want to talk through their problems. They want to vent. They want to get it out. Sometimes hearing yourself saying it helps you to bring clarity and be able to arrive at the solution that you want to pursue. Oftentimes men, when they hear a woman being able to express these things, they go into fix-it mode and solution mode, and that's where all the advice giving comes. And it's not just men and women. I think people sometimes who are more, who tend to make decisions based on logic more, would do the same thing as well. How do I simplify the situation as quickly as possible? But it's such an important skill, and I think what the exercise that the eye-opener gives is so much harder than people would realize. Taking time to listen to someone without interrupting, without kind of moving them along in the conversation, just listening and feeling, it takes a lot. It takes, and I think it's because a lot of times we just go instinctively with the logical part, and sometimes I think emotions just make us uncomfortable. So we want to move on from that part.
Yeah, absolutely. And I think that's kind of what the first part of the eye-opener is getting at. The reason that we do it to other people is that because we do it to ourselves. You know, when we're, I was joking just now while you were speaking, saying that when you were talking about people being more logical or trying to rely more on logic, and that's definitely me. So, when I'm trying to make decisions, or even if I'm trying to get out of a difficult spot, then I'm usually trying to simplify it, or I think about the path to, how do I get it. But you have the bad habit of really ignoring what the feelings are, and even if you are thinking about a solution, and there's nothing wrong with trying to find a logical solution to a problem, but if you even just take the moment to just try to recognize all it is that you're feeling in that one moment, and you find that it becomes you're in a much better place then to make the decisions that you need to make, because then you're more centered, you know exactly what it is, how you feel, because your mind can be telling you that this is the best way possible, but if you're not really listening to your body, you may end up in a situation that you're not 100% happy with, because you didn't really consider how you would feel or how you were feeling when you were doing it. So we have the bad habit of doing it to ourselves, and it's something that you do have to kind of train or try to make a conscious effort towards doing. But definitely it can improve your own decision making and the way that you can reach out to others as well.
Yeah. And it, in general, just make us kinder. And I think, we hope that that's what the eye-opener encourages you to be today. And it's one that helps you at least to understand why you make your decisions, or why you have the conversations that you do. But we got to get moving into our show for today. And of course, the big news from last night is that we have a number of new positive cases, but two of those include Prime Minister Briceño and Cabinet Secretary Stuart Leslie, who've been confirmed positive for COVID-19 as of yesterday. I know that's a big buzz in the country right now. The situation with COVID-19 is a very serious one. We had 4 more deaths reported last night, and in addition to that, additional positive cases that have been identified. Yes, and
of course, we know that we have been seeing we've been seeing the numbers more or less consistent, or let's say a consistent increase. Let me say, in numbers over the past few weeks, and it's always, or we always take the opportunity here to remind you as our viewers to take all of the safety protocols extremely seriously, because the risk is ever present. Especially we know with these rising numbers that it's time to be more vigilant than really ever, based on the numbers that we're seeing. But of course, we do want to wish the Prime Minister and the Cabinet Secretary well on a speedy recovery. And we hope that, you know, all those that are affected by, you know, by COVID, the same.
Of course. I think that's the message going out from everyone right now. We do wish them both the best, and that they would not have any severe complications. As we know, this is the it's a part of the challenge of COVID-19. We don't know who's going to get a severe form. Of course, there are certain factors that make you predisposed. One of the things we've also seen is where, as much as in the beginning, we all wanted to believe that it was mostly the elderly that would be severely affected. We've seen young people hospitalized. We've seen young people lose their lives. And so it is something that we have to take very serious. And these confirmed cases, which we're at 2,252 active cases at the moment, and 120 souls lost so far to COVID. And, you know, I think we have to be a lot more vigilant in our actions. I'm really looking forward to seeing what the numbers are going to be this week, especially because Wednesday makes 2 weeks since the election. And we know that there was a lot of movement that took place on Election Day, the day after Election Day, and many would look on and say, well, that could be a potential spread. So we also had right after that another flood that had people being moved out of areas. You know, I think the health concerns were secondary at that point in time. So it's a very critical time. We've been told, and we do have to get more information on that there's a bit of delay with the test. So we have to keep paying attention and know that there are a lot more cases out there than what have been identified so far. So we just have to be careful.
Yeah, that's absolutely true. And you know, Marlene, I'm interested, or I'm wondering what, if any, sort of announcements are going to be made over the next couple of days, or probably the next few weeks, because last week the Prime Minister did give an address to the government press office that was talking about really addressing the COVID situation. That was one of the aspects that he discussed, and really talking about a plan to combat to combat the spread based on the numbers that we're having. So that's something that I'll be looking out for, to just as a matter of interest, just to see what, because, you know, obviously we always tell you that, you know, washing hands and wearing masks and maintaining your distance is important, which it is. But we're seeing internationally a lot of countries going back into lockdown or putting stricter measures or curfews, things like that. So I'm wondering now, because we know that Christmas time is coming up, and there are the holiday season, and it's a time when people will naturally want to gather and be more social and do things. So I'm interested to know what that will sort of look like in Belize.
Absolutely, and this, you know, I think Isani and I were discussing it yesterday. It is, the entire country is waiting to hear what's going to happen, what's going to be the way forward in addressing COVID-19, at least in the short term. We're seeing 4 to 5 deaths a day. We're seeing 60 to 70, sometimes more, new cases diagnosed each day. And so I think no one can doubt that we're definitely going upwards rather than seeing the flattening of the curve or lesser cases. And, you know, it can very easily be argued that any leader who took on or who was successful after election knew this was going to be the first priority. Prime Minister Briceño, in his campaign, said he put together a task force. We haven't seen that task force being formed yet. There is a virtual cabinet meeting that should take place today. I'm hoping that some decisions will be made, at least in getting a medical team, a science-based team together to be able to make recommendations as to how we move forward and to see what that will mean. Again, I think it's always important to say that we need to see leadership in it, but we also have to recognize that we have our own individual responsibilities as well. It's twofold. You cannot, I mean, it's two-part. You can't separate one from the other. And whether or not lockdowns will be considered, I don't know. It's, you know, I think it is interesting when you see European countries moving back towards that. Everyone has acknowledged the economic impact of lockdowns. However, we still see people going back to it as a way of kind of just getting things under control quickly. So it's yet to be seen what actions will be taken here, but it is very clear by the numbers we're seeing this action is necessary as soon as possible.
Yeah, absolutely.
Yeah.
But before we get our show started, I was looking at other reports, and I think that on the more encouraging side, there are reports of vaccines or treatments being developed that are looking pretty positive for now. So that's one, at least, sort of an optimistic note to leave this part of our discussion on. So
the third is the Oxford vaccine, which is really good for us too. I'm not sure what happens now with the win of President-elect Biden in the United States. We know that President Trump had disassociated himself from the World Health Organization. Our vaccine access is very dependent on kind of this global community saying, if we develop a vaccine, we'll ensure that the very poorest country get access as well, instead of keeping them all for ourselves and just protecting our people. So it will be interesting to see what happens as the vaccines become approved, as they have the rollout, and seeing especially which ones we have access to, as we are a part of the World Health Organization's COVAX facility. So it's really good to see that happening, of course, but we have to pay attention and see what the implications are for us. All right, so we got to get moving into our show, and we talked a bit about COVID. This morning, we wanted to get the conversation on COVID going with the experiences of those on the front lines. We've seen nurses and doctors and healthcare workers taking to Facebook and speaking about the personal sacrifice that they're making, staying away from loved ones and doing all they can to help people recover from the disease. And so we're going to talk to two nurses who have been on the front lines and what their experience is like and what their message is to the wider public.
And for our second conversation, we are going to be speaking with youth ambassadors to talk about an interesting initiative to increase the presence and resilience of youth. So that's going to be an interesting conversation. We're going to have a representative come in to discuss all about that project. And then finally, we are going to be speaking with members from Belize to talk about the awareness of kidney disease, and also how insurance can help with that. So we are going to close off our conversations for today with that discussion.
All right. So that's what we have in store for you in terms of conversations this morning. But we got our birthday shout out as well, and we are saying a happy birthday to
Ashanti Ling. So from all of us here at Channel 5 and Open Your Eyes, Ashanti, we hope you have a great happy birthday, and we wish you many more, and that you have a great day.
That's right. Do enjoy. We'll take that break now, and when we come back, we'll talk to the frontline workers about what their experience has been like fighting COVID in the hospital setting. So please, stay tuned.
In these challenging times, the one thing that is certain is that the Belize Bank Limited is here for you. There is nothing more important than your health and safety, and we continue to make every effort to make banking safer for you. Our staff is working around the clock to make sure you can do your banking conveniently 24/7 using our mobile banking app and online banking, and keeping ATMs up and running. We value your relationship with us and are here to provide the support you need. First responders are also out there 24/7. Thank you, healthcare workers, security forces, firefighters, caregivers. You are all appreciated. Stay safe. We will get through this together. The Belize Bank, our country, your bank.
Todos estamos en riesgo de contraer la COVID-19, por lo que es importante reconocer rápidamente los signos y síntomas de la infección. Los síntomas más comunes son fiebre, tos seca y cansancio o fatiga. Algunas personas también pueden tener dolor de garganta, dolores y molestias, congestión nasal o diarrea. Pero algunas personas también han reportado conjuntivitis, dolor de cabeza, pérdida de sabor u olor, sarpullido en la piel o un cambio en el color de los dedos de las manos o los pies. Los signos de alarma de emergencia que requieren atención médica inmediata son dificultad extrema para respirar, dolor constante y severo o presión en el pecho, confusión, dificultad para hablar o moverse, labios, rostro, dedos de las manos o de los pies azulados. Para mayor información, llame al 0800-664-2273. Protejamos nuestra salud.
With Smart's Loyalty Rewards program, you have tons of rewards waiting to be claimed just for using prepaid services. Now, let's get those rewards. But first, we need to download the Smart Belize app from Google Play or the Apple's App Store. Open the app and click Register. Then, click Get Activation Code. You'll receive an SMS. Now, enter your number and the code to activate the Smart app. Open the app and rewards are now accessible. In My Account homepage, you'll see how many stars you have and how many you've redeemed. To see a list of rewards available, just click the Go to Rewards button and let's start redeeming. With My Rewards, I'll redeem 140 stars for 1,000 megabytes of data for more TikTok uploads and 60 stars for 75 SMS. It's that easy. You can also get extra on uploads with your stars by just clicking Activate, and the next time you put in credit, you'll get your reward. So remember, just for making calls, texting, and using data, you get free reward points that you can redeem using the app, all from your fingertips.
Smart, bringing people together.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we are moving into our first conversation for this morning. We're talking about working within the hospital setting within the time of the pandemic, and we have two nurses who are going to be sharing their experience with us. We have Simone Thomas, who's a registered nurse and midwife at the Southern Regional Hospital. And we have Naila Correa, who is a nursing assistant at the San Ignacio Hospital. Good morning, and welcome.
Good morning. Good morning.
Well, thank you for joining us this morning. And I just wanted to start off by getting a bit of an overview as to what your roles are at the health institutions you're working at right now. Let's start with you, Simone.
Well, with me, I am working as a midwife. I'm a registered nurse, meaning I could work at every ward in the hospital. But since I'm a midwife, my basic focus is to work at the labor and delivery ward, the gynecology ward, and the maternity ward, dealing with mothers and their babies, mothers who got C-section, other females who have other gynecological problems other than being pregnant.
Okay.
Yeah.
And Naila?
Good morning. Well, I can work in different departments. Once I'm in the supervision of a registered nurse. I'm a nursing assistant, so I usually work at the emergency department, outpatient department, and now flu clinic or isolation unit. Well, In the flu clinic, we usually assist medical officers to attend and usually triage and helping paperworks to prepare patients for swabbing. So more or less, it's assisting the medical officers in that aspect.
How long have you been working at the flu clinic?
Initially, from the beginning of the pandemic.
Oh.
Oh, okay. Yeah, that's actually where I wanted to go in terms of getting some of your perspective on work before and post-pandemic. So maybe, Simone, you can give us a little bit about your history and what the working in the pandemic meant as a big change.
Well, at Southern Regional, there were basic like confusion as to who will go to deliver COVID patients, like mothers. Because with us, it's all the midwives who, basically the midwives do the deliveries at the hospital. And so it was like people were scared, not knowing what they're gonna encounter, how to handle the COVID-19 virus. So it was a back and forth between the medical officers doing the deliveries or the midwives doing the deliveries. So towards the end, it was established that the midwives are going to go do the deliveries in the COVID unit.
Okay.
But for us, we haven't had any case delivered at Southern Regional as yet. But everybody who is pregnant comes to labor and delivery ward. Whether you're asymptomatic, whether you have COVID that you do not know, you have to pass through labor and delivery ward. And that makes all of us exposed unknowingly. So
how does that work though? Do you dress, because the isolation clinic, you wear more protective gear than the rest of the hospital? Is that the case?
Because in the COVID clinic, you have patients who come in there with COVID or highly suspected COVID. But for us, it's just like you treat everybody like they're COVID infected.
Okay.
Because we wear our mask, our surgical mask, our shield. When patients are in labor, they're breathing. So you have to put on your shield to protect you. And we have our gown, the regular surgical gown that we use, and our shoe cover. So you basically have to protect yourself. But then sometimes we tend to be relaxed because we say we are not directly in the COVID unit.
Yeah.
But we can't afford to let our guards down because with this COVID-19 now, there are more asymptomatic people than there are symptomatic.
Yeah.
But what has been set like protocol is that everybody after 36 weeks, every pregnant woman should get screened for COVID-19. Because after 36 weeks, you go into 37, 38, where you become a term pregnancy that is expected to be delivered anytime after 37 weeks, which is normal term gestation. So they're supposed to be screening every pregnant mother, and the result is being forwarded, sent if there is any case, they told us, and to get us prepared to know when the patient will actually be within 38 to 40 weeks where it is expected.
Okay.
Then they put us on call saying, all right, if you're not working today, you're off, just have your phone nearby in case the patient goes into labor, and for that day, it will be you who will be delivering these patients. So that's how it is with us for right now.
Yeah. Right, so,
but like I tell you, we don't have any patient as yet who are delivered. So,
right. So it sounds to me like they're trying to limit the person-to-person contact by having you on a sort of rotation then.
Yeah, basically they say it's all midwives, but like we say, everybody have their day when they're on call. It's not every day it's you. Yeah. Today it may be me, tomorrow it's another one of my co-workers. So you don't know when the patient will come, but you just have to be on your guard that someday this patient might come in.
Yeah. So Simone, we know that you were one of our healthcare workers who in fact did contract COVID-19. Tell us about your experience.
My experience, I had a little symptom, mild symptom.
How long ago was
But
it? Sorry.
I got diagnosed the 19th, 20th of October.
Okay.
Yes. I went back to work the 20th of November, like literally 1 month away from work. To be honest, I went to get swabbed because my mom got swabbed as well. She came to visit me for my birthday on the 1st of October, and like 4 days after she fell ill. But we didn't think it was COVID, but it was. She said it's a feeling she can't explain. So we said, all right, me and my brothers decide we're gonna let her get swabbed. So she went to get swabbed on the 6th of November, but her sample got spilled. So she said it was traumatic. She didn't want to go back. I said, all right, well, I'll go with you so I could be your support. So going to get swabbed. Then when the result came out, they said it was both of us. But before that, I was still working because I had to wait for my result for approximately 1 week. While working, I felt like headache and I felt a little bit weak. I said, the morning I called my in charge, my matron, and I told her, can you please grant me emergency leave? I'm not feeling well. Just 1 day, then I'll come back to work. She said, okay, fine. And then I went back to work. On the 18th, I was off, and they called me and they said, you know what? You can't report to work anymore because you're tested positive for COVID-19. So, I mean,
Let me just ask one question there. So when you were swabbed, do they tell you that you should continue with your work, or do they ask you to isolate? What's the advice that they give you after you've been swabbed for the test?
I have to work because Social Security, they said Social Security doesn't start paying till your test result comes up positive. So I had to be at work with my mask.
Did you feel nervous at all, knowing you'd been swabbed and going back into the hospital?
Yes, I did feel nervous because with our midwives, a lot of them are elderly and have comorbidities, and a lot of us are overweight, and like to expose them, knowingly that I got swabbed for COVID-19. I tried my best to do what I had to do to protect myself, but still, it's just a feeling that I could be passing it on to somebody else.
Yeah.
So.
And then you were out for an entire month. Was that because you were symptomatic the entire time?
Because I had headaches, basically, and I felt weak for a couple of days, like 3 days. And then when I got re-swabbed, it still came out positive. And they said I continue with this headache. So they said to keep me off until, well, what they were saying is that there was a memo stating if you're asymptomatic, after 14 days, you need to come back to work. But I wasn't feeling 100. So, and I know there are a lot of elderly people working with me who maybe the virus maybe didn't hit me hard, but it could hit somebody else harder than. And we see the amount of death occurring daily in Belize, around the world. It's alarming.
Yeah. So you continued, you test positive after 2 weeks and you still had symptoms.
Yeah. Basically. And
let me
I had sorry.
No, go ahead.
Go ahead. No, I said, and then my kids are with me and my family. My mom had to be with me because she was symptomatic, basically. She was weak. She couldn't do anything for herself. So I had to take care of her and take care of myself as well, and my 2 boys, which one of them tested positive also. So.
And I was going to ask that about how your mom fared off. So she had it a bit more severe.
Yeah, she had it a bit more severe. She couldn't do anything. She didn't have any appetite. She couldn't taste. She couldn't smell. So she was really out for a good 2 weeks. Yeah.
Okay. Wow. All right. Well, thank you for sharing your experience with us. Nyla, you also contracted the virus. Tell us about what happened there.
Well, actually, I was on vacation. I I used to live at Orange Walk, so I went to my hometown. Well, I said I was going only to spend 4 days and then come back to San Ignacio since I work here. And during those 4 days, my brother started with flu symptoms, and then the rest of his colleagues. So they got swabbed and they tested positive, and that's how I ended up in quarantine at Orange Walk. Nurse Simone, just like Nurse Simone, I only had mild symptoms, only headache, cough, on and off, dry cough. Sometimes I felt like tightness to my chest, but that was it.
How long ago was that?
I tested positive on the 4th of November.
Okay, okay. And so you've just completed your 2 weeks, no?
Yes.
Okay. Now let me ask you though, because this is, you work in a high risk setting. How do you feel knowing that it was outside of that high risk setting that you contracted the virus?
Well, before I went on vacation, some of my friends did told me why was I going to Orange Walk because it was already an endemic area. But I told them that I wasn't going to be outside. I was only going to be at home with my family. But I didn't realize that somebody else could have bring the virus at home. So I guess that can happen to anybody, right? Although you have your precautions, maybe not everyone does the same like you. So I guess that is what happened.
Yeah.
And your quarantine experience, what was that like?
Well, I wasn't afraid. I know that I knew what COVID can cause. Well, I was happy that I only presented my symptoms. I was worried a bit because of my grandmother and my aunt, since my grandmother is already 80 years old, 84 years old, I mean, and my aunt, well, she has a chronic illness, she's hypertensive. But thank God that my grandmother, she didn't contracted COVID, and my aunt, she was asymptomatic. So I felt happy about it.
Yeah. Yeah. And for you, Simone, the idea of moving outside of your high risk setting and then getting it when you're with family.
Marlene, to be honest, I still do not know how I contracted COVID-19 because, like I told you, my mom came to visit me and she was the one who presented symptoms first. But I don't know if I had already had it because I was basically asymptomatic, just a mild symptom now. So I don't know if it's outside or it's inside because basically my family, they stayed away from when COVID started getting on the rise here in Belize. They said, you know what, I won't go to your house because you're a frontliner. You have to be there. I won't come to visit you.
Yeah.
But it was my birthday, so my mom and my siblings, they came. So everybody was basically here with me. And then she was the one who showed signs and symptoms. And when all of us got swabbed, it was me, my brother, and my son, and a cousin of mine who tested positive.
Yeah, yeah. It's such an important lesson, and one I think that we have learned over time with this disease is that, you know, you're most likely to catch it. I think they call it the three C's, from close friends and acquaintances, from the family members that you live with, and your co-workers. The three places that we feel most comfortable are often the places that we are most likely to get the virus from.
Yes.
How do you take this experience and use it as a lesson for everyone else, especially as we continue to see the rise in cases across the country?
Yes, I believe so too. With this close contact, especially with your family, we tend to get comfortable because it's our brother, it's our sister, our aunt, our cousin, And we said, you know what, we need to we don't need to social distance, we do not need to put on our mask. But that's the wrong thing to do, the wrong way to go, because COVID has no face. Most people are asymptomatic, and you do not know how it will affect you, because it's not affecting them by them showing their signs and symptoms. So we have to be very, very careful, treat everyone like they are COVID-19 infected, because everybody's body responds different to COVID-19.
You know, Simone, you said something a little bit interesting earlier, in that you don't know how it is that you contracted COVID. Being that you are a frontline worker, when you were diagnosed, were you thinking back to, well, it could have been any random situation, or was it perhaps, or do you think that, well, perhaps either you or maybe there weren't enough measures in place in where you work, or what sort of thoughts were going through your mind when you did test positive, knowing that you are a frontline worker working in the hospital?
Yes, thinking about what could have been done better at work, because yes, there are a lot of things that are not in place that should be in place, and especially dealing with pregnant mothers coming into the hospital. They are not screened at the entrance or the emergency. Everybody just comes straight to the hospital, into the labor and delivery ward. Usually they say to take your temperature, to ask for, and to interview, if you're in high risk areas, and other questions. But no, they come directly to us. When they come directly to us, you have no choice but to deal with these patients. They're already here for you. So if that could have been happening from the beginning, like what we suggested a while ago, maybe it would have been different for me, because at the end of the day, we have to work together as a team to try to combat this COVID-19. So yes, I put some blame on the institution, and I put some blame on myself, that means me being careless or not forgetting to put on something right, or take off something right, or didn't wash my hand after dealing with somebody, or certain things you have to just try to remember and see where I went wrong.
I love what you said earlier. It's just, you cannot let your guard down for a moment, because that may be the moment that you come in contact or exposed to a person. And Nyla, you said something that really struck me as well, that you went to Orange Walk, you knew that there were a lot of cases there, but you thought, like many people think, I'm going to stay with my family or people that I know very closely, and I'm not going to interact with the wider public. But you can't trust that everybody else who comes together in that household is doing or taking the same measures. How do you use that as an example for others?
Well, like Nurse Simone had stated before, we tend to get comfortable. We, especially with our family, we hug them, we kiss them. If we have niece, nephews, right?
Oh, kids, yeah, they don't understand.
And it's hard. It's hard because you're used to them already. And well, I guess that we have to be really careful in that aspect. Like Nurse Simone said, we have to consider that everyone is COVID-19 positive, even though they don't have symptoms. And although it's our family, we have to teach them, we have to educate them about it, especially to the kids, because most of the kids are carriers.
And what is your experience now? I said, well, first, you're back at work now, right?
Yes.
So what is your experience now? Because Simone was talking about, yes, the personal responsibility, but she was also expressing concern over perhaps the measures that are in place and perhaps the exposure that she as a frontline worker may face. So I'm wondering what your thoughts are now going back to work, and what's your experience like? What sort of things or protocols are put in place that you have to follow?
Well, at the beginning, I was thinking of more. I was afraid about discrimination, right? Everyone is afraid of COVID. Nobody wants to contract it. But my colleagues, they treat me the same way. I had a lot of support from family, from friends, from my colleagues while I was in quarantine. Getting back to work, I was kind of afraid that I can get reinfected. However, I know that I have to be more careful than before. Just always have my mask on. Try not to maybe have breakfast or lunch with other colleagues, especially because I have already contracted the virus, right? And just not to expose them.
Those are the little things we take for granted, right? Who you're going to take your mask off in front of and eat with, potentially exposing each other to COVID, hugging the little ones in the family because they don't understand sometimes, and it's really hard to get them to that place. You both are in two different parts of the country. And where you do have cases, you don't have as many as we've seen in Orange Walk, growing numbers in Corozal, growing numbers in Belize District. What do you see in the wider community, in the places that you go, within your work itself, how your coworkers are taking it seriously or not, and even your family members? Do you think that people have really grasped the extensive measures that need to be taken?
Well, for me, going around town, I've seen a few with masks and few people gather sometimes together, but basically at work, everybody is trying their best. They have seen and heard all of the data that has been increasing with the deaths, increasing with the case, and everybody is scared because nobody knows how their bodies are going to react to COVID-19. And especially the men, we see more men dying, they're more scared, and so they're trying their best to do what I believe we can do better because the case keeps on going up. And I think it has to do a lot with contact. We are getting so comfortable with each other, which shouldn't be.
All right, so send your message out to our viewers one time. Tell us what you would like them to know and understand about what we need to be doing right now.
The entire population, the country of Belize, we need to continue protecting ourselves. Keep your mask on at all times. Teach your children to wash and yourself to wash your hands every day, all day. You keep your sanitizers in your pocket, in your purse, whatever you do, whatever you touch. Any surface you touch, you have to think it has the virus particles on it, and you do not know. So always wash your hands and stay away 6 feet from close contact with families and friends.
That's right. All right. And Nyla? What's it like in San Ignacio? Tell us.
What it's like in San Ignacio?
Yeah. You see people taking it seriously?
Yes, they do. At first, it was a bit challenging with social distancing at work. We had to really speak to the public concerning that. But I guess after they saw the news and the amount of people that had contracted the virus, I think they took it more serious, and they were really cooperative while going to the hospital. To the country of Belize, I would like to say that please wear your mask properly. That is the key. Wear it properly, because everyone can have a mask, but if you're not using it properly, then it doesn't make sense. Wash your hands often. Keep social distancing, like how I mentioned before. Just believe that everyone has the virus, and that's the only way you can protect yourself, even though it's your relative. Don't trust that much. If you have flu symptoms, go visit the hospital, seek medical attention as soon as possible. Don't think it's just a regular flu. It's better to be in the safe side. And I just hope that we can be able to manage this pandemic. The year is already ending, and I know that it wasn't that good enough for everyone, but God is protecting us, and God is with us.
All right. Well, thank you so much for joining us this morning. And we really appreciate the work that you're doing in the individual healthcare settings, but also that you are willing to share your story with us. So thank you very much for that.
Thank you, too.
Thank you too.
All right. Stay safe, ladies.
You too. Okay.
Right. And with that,
we are going to be taking our a short break, and when we come back, we are going to be speaking with youth ambassadors to talk about how to increase the resilience of young people. So please stay tuned. We'll be right back.
Update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Technology is ubiquitous, and it's transforming how, when, and where we work. Fulltech Systems is placing award-winning devices in the hands of information workers, allowing them to work without compromise in a world without wires, to innovate, create, and to maximize productivity anytime, anywhere, satisfying the needs of the desk-centric remote and field worker and every other worker in between. We are providing the industry's best devices to businesses going through the process of digital transformation. Partner with us today to provide the solutions that will allow your employees to work effectively and efficiently to enhance your customers' experience. Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
As the demand for entertainment and gaming increases, so does the demand for bandwidth and faster speeds. If you're a gamer, you know exactly what I'm talking about. I'm talking about extremely reliable, low latency, high-speed internet connection that is crucial for smooth gaming. A next-generation connection. That's why I chose next-gen high-speed internet for my streaming needs. They are by far the best internet service provider in Belize. NextGen has noticed the vast growth of gaming audience, and as an innovative company, they are the first broadband internet service providers powered by gamers. Now, they're taking the lead in providing a package that's just right for us gamers. So what are you waiting for? Sign up today.
If we are only as strong as our families, businesses, institutions, and the communities that surround us, then by giving businesses the power to grow, entrepreneurs the ability to expand, and by giving our families the right to own something, the Belize Bank gives you the power to build a nation, our nation. We are stronger together. The Belize Bank, our country, your bank.
And we are back. And if you're joining us right now, we are just getting our second conversation started. And we are speaking all about a Youth Ambassadors project to increase the resilience of young people in Belize. And here to talk to us all about this, we've got Kevin Mendez, who is a consultant from RET Americas Belize. Good morning, Kevin.
Hi, Gavin. Good morning. Yes, so I'm a consultant working with RET Americas on a project. So it's a Youth Ambassadors project to promote resilience of young people to reduce incidences of gender-based violence. What's pretty unique about this project is that we're doing it in the communities of the Belize River Valley. So we're focusing directly on Scotland Half Moon, Double Head Cabbage, and Rancho Dolores.
Okay, cool. That's pretty interesting. Well, before we get into the details of the initiative, why don't we start by talking just a little bit about RET Americas and a bit of the work that they do.
Awesome. Thank you. So RET Americas has been operating in Belize since 2015, working with young women and young people in general in building resilience and empowering their capacities to be able to address issues of gender-based violence, issues of gender equality, and be able to move forward when it comes to sustainability in times of crisis.
Okay. Now, it's when you talk about building resilience in young people, what is the objective here?
So it's about creating platforms and programs where young people are able to understand, the different dynamics. Well, in this case of gender-based violence, what are the different manifestations like? Be aware, be able to look out for those things, and then whenever they whenever they have an encounter with such situation, they're able to know how to react, be able to adapt, and at the same time, be a lookout for their peers and reduce the incidences happening in their communities.
All right. And in terms of this project, let's get started by discussing how it came about and how those particular communities were chosen.
Sure. So this project that's being implemented by Red Americas is commissioned by the Canadian Embassy. So it's interesting that it was like these particular villages were selected to be beneficiaries of this project due to their vulnerability when it comes to climate change. For instance, we know right now they're going through some effects of hurricanes Eta and Iota with the flooding. And recently, with the whole COVID pandemic, we have seen how stresses like climate change, stresses like this COVID-19 pandemic have altered, the response of people when it comes to gender-based violence. We have seen increases in gender-based violence. So it's about working in these communities that are facing, crises like this, and being able to, bring that awareness about what gender-based violence is, and then, being able to also like educate and communicate with their peers, in case like a situation like this happens, and what are the avenues for referral and support. So that's how like these villages are getting impacted. So through this project, we aim to target at least 80 young persons from these 3 villages, and then reaching out to their wider communities. So we're expecting to have at least 500 beneficiaries from this project.
So how do you impart this message to them? How do you, gender-based violence is such a deeply complex issue that may manifest when they're young, but is more likely to manifest as they get older and take on additional responsibilities. How do you, what kind of messaging or behavior change do you try to impart?
Okay, that's a good question. So as you said, like sometimes gender-based violence can manifest itself in ways that we are not aware that it's a situation of gender-based violence. So for instance, gender-based violence is not just physical abuse, but it can manifest its way in, verbal sexual assault, even like economically. When it comes to young people, we're seeing incidences of gender-based violence, even not just in the household, but even in their community, like in their school. So it's about bringing this information to young persons to be able to realize, hey, I was not conscious that I was a victim of gender-based violence. So bringing that awareness, and then for them to be able to react in a manner that they know they're victims, but then at the same time being able to reach out for help. So like a big part of this project, other than bringing the awareness, is to build some sort of solidarity among the young people that will be participating in this project, so that they can be, let's say, brother's keeper or sister's keeper. And then, in case somebody is going through that situation, then they will be like supporting and then make the proper referral to like the different agencies that deal with gender-based violence. So it's about, I can say removing that normalization about what gender-based violence is, and knowing the different manifestations, and then providing the appropriate support.
That's a key thing that you said there, removing the normalization. And we bank a lot of our hope of change on our younger populations. Is it a part of being able to have them recognize just the different ways that or perceptions of gender, our perceptions of gender roles, and of course the way violence can be introduced, whether through words or actions or sometimes through psychological abuse as well, that this young group will be the ones to kind of get the change going within their community?
Yeah. So when we were doing our mapping, we asked the different village leaders and community members if they felt or if they noticed any issues of gender-based violence or incidences of gender-based violence in their community, and if they felt young people were getting affected by it. And most people said no. So that was interesting. I mean, it's good to hear that young people are not going through that. But as we talk about how violence has been normalized, some people can grow up in this situations that they will have just it's a cycle. They might just be like, okay, my parents used to do it, my grandparents used to do it. So eventually, whenever you bring them the information, you analyze what current situations are happening, then they realize, I did not realize this was gender-based violence. Yeah. So it's about imparting that knowledge to them. That's one of the ways of how we can do youth empowerment. And like I said, it's also about building that solidarity among young people in the communities.
And as a young man, we talk about gender-based violence a lot. We're going to see the start of 16 Days of Activism tomorrow. And a lot of times the faces are women. As a young man who's leading this particular initiative, what is the role and involvement of men in this process?
I love that question. As you say, most victims are women. So most perpetrators are men. And it's important for us men to, for one, be aware that we can also be victims, but also that, we can also be part of the solution to end the cycle of gender-based violence. So it's about understanding, our emotions, our awareness of self, what are our triggers, what does trauma looks like, how do we cope with trauma, and how do we address trauma, because gender-based violence can happen, at different points in the life of somebody. So maybe whenever they're in their adulthood, then they will start reacting to those traumas that they experienced when they were younger, and then they start, being perpetrators. So it's about, addressing it from a young age to understand the dynamics of gender-based violence, the dynamics of trauma, how have they been coping, and then being able to provide the appropriate ways where they're going to be able to support each other. I like to use the word heal, to heal from their trauma so that they can be able to heal their community. So I am really happy and thankful for the opportunity, as you're saying, as a young man, to be able to reach out to my other young male peers and be able to, normalize and build that solidarity between our female and male counterparts. And more so, in talking about gender equality and moving it from this heteronormative context that it's only affecting heterosexual people. So let's talk about, how, as we're talking about gender equality, there's a different spectrum of people that can get affected, that are, sometimes left in the shadows, and their issues are not addressed. So it's about addressing gender-based violence, involving young people, but involving the different or the diverse groups of young persons that we can target in the villages.
So what's your measure of success when you're trying to impart or impact the resilience of young people? How do you know if you've succeeded?
That's a really good question. So it's like I'd say there's different indicators that we're looking at. One will be the community involvement. So what activities they are going to be doing in that area. So like as in like open days or different sessions in their community. So what are also like, how has the language changed when it comes to gender-based violence? Are they able to, you know, is there more cases being reported after the education? And also like, are there more referrals? Is the interaction between young people healthy? Behavior change will not happen, I'd say, because this project is only for 6 months, you know, so it would be good if behavior change can happen in 6 months, but what we intend to do is that continue providing that support on behalf of Red Americas post the 6 months to see how things have changed in the villages. So how has the interaction been like again? What kind of community events they're having? Has there been any more cases of gender-based violence reported and addressed? And how has the solidarity among young people, you know, been across? Because, like I said, we intend to target 80 young people at the moment. So we're doing a series of one-day workshops to talk about gender-based violence, talk about impacts of mental health and gender-based violence, and advocacy. So out of the 80 people that we will target, we intend to recruit 20 young persons that are committed to be agents of change in their community to form part of the Red Youth Ambassadors program. So with the support from Red and our international partners, we intend to, you know, continue providing them skills for them to continue doing work in their communities and continue impacting, I'd say, the whole Belize district and eventually the country.
So if other young people want to get involved, how do they get in touch?
Great. So I shared a flyer with y'all, but if they want to get involved, there's like, I have my email address on that flyer. So that's how they can get in touch. So kmendez@redamericas.org. Just send an interest that, hey, I want to be involved in this project. What we've also done is that we've partnered with the Department of Youth Services, with the Belize Family Life Association to, as I say, to like have these one-day workshops with a series of young people so that we can educate them about this and being able to recruit them. So as you can see on the flyer, the requirements are, you know, are you willing to be an agent of change in your community? Are you between the ages of 18 and 29 years? And if you live in these villages, then you're welcome to join this this project, which I'm really excited to be able to conduct on behalf of Red Americas.
It's also beneficial for the young people who get involved because you are teaching them skill sets or life skills that they need, and that will help them as they continue on with their different interactions.
Yeah, that's true. Because I mean, as we talk about gender-based violence, we're talking about gender, we're talking about equality. As we're talking about the youth club, we're talking about leadership, advocacy. So these are skills that can, you know, be used in a wide array of things that they want to change in their community. So we're starting with gender-based violence, but I'm sure that these skills can be applied in other things that they want to see change in a positive way in their communities.
Well, it's an important place to start. And so we want to thank you for telling us all about it. We hope that more young people are encouraged to participate. As we noted, it's both about being able to build that support network and being able to assist in the situation of gender-based violence, but also there's a lot of benefit for them on an individual basis. So Kevin, best of luck, and thank you for telling us all about what you're doing.
Thank you. Thank you for having me.
All right, stay safe.
Yes, you too. Bye.
And with that, we're going to go ahead and take a break. When we come back,
we're going to be speaking all about the awareness of kidney disease awareness, and we're also going to be speaking about how insurance may be able to assist if you are experiencing some of those conditions. So please stay tuned. We are just going to be taking a short break, and we're going to be right back.
Currently, we're using Smart Elite VoIP calling plan. We use it inter-branch, we use it to call outside, and we also use it to call internationally. It's far cheaper than what we used to have before. Our equipment are new, PBX box is new. So the PBX is very good because I can call to my Sartaneja branch, I can call to my Kikaka branch, I can call to San Pedro branch, and there's no cost using the PBS. Actually right now, since we're in different locations, I can call main office from where I am at a no cost using the PBX system. I would recommend it, sure I would, especially the big enterprises who has a lot of employees. There's a lot of reduction in costs, 50% of saving. But that on a year, it's a lot of money that we're saving. Money that we could return to our members since we give back dividend to our members.
Visit our showroom or call 670-6710 to find out how Smart's corporate plan and PBX systems can benefit your business. Consultation is free.
The virus that causes COVID-19 may be spreading in our community. People might have the disease even if they have no symptoms at all, even when they look healthy. Because the virus needs us to spread from one person to another, we can stop it from infecting others if we practice physical distancing. That means stay at least 6 feet away from other persons. Don't shake hands or exchange hugs. Do not gather in groups. Stay home if government officials tell you to do so. Use social media or telephone to communicate. Avoid crowded and enclosed spaces. Work from home if you can. Stay home if you are sick, except to get medical care. Avoid close contact with sick people. Don't visit anyone who's sick in quarantine or in isolation. Give them a call instead. Help keep Belize safe.
Contraband is the illegal importation of goods such as alcohol, tobacco, foods, and parts. Apart from breaking the law, smugglers are also now endangering the health of all Belizeans. They risk bringing coronavirus into Belize with their contraband. To keep COVID-19 out of Belize, everyone entering the country is screened and quarantined. But contraband smugglers are not using legal entry points and are bypassing all safety measures. And these same smugglers are moving among the population. They could be carrying the virus. By coming into the country illegally, they could cause outbreaks of COVID-19. Buying or smuggling contraband is putting yourself, your family, and the entire country at risk. Report smuggling. For SMART, call 0800-JUMPERS or 0800-BORDERS. For Digi, 0800-SAVE-BZE. This message is brought to you by the Belize Police Department and the Belize Bank.
In partnership with the British High Commission.
Why, Tony?
Why, kid, where you going, man?
We actually come see we can need to buy a stack of them plastic plates and cups from the grocery shop because I run low.
Boy, I stopped importing that thing since April 15th, you know. And I just ran to the last batch, must have been like 3 weeks back, you know.
Man, do I usually have anything? Where you going?
Check this, right? Under the new law, we ban all single-use plastics, so that the cups, plates, forks, spoons, and knives, all of that. Since April 15th, can't import none of them. Starting January 15, 2021, you can't manufacture them. April 15, 2021, you can't sell them. And after July 14, 2021, if you get catch with any other thing, you will get fined.
Me never know this. I guess I have to make some changes then. I have to make the customers know that anything not available. Anyways, bro. Thanks, man.
No problem, man. Take care.
Reduce your risk of viral illness like the flu or the coronavirus. Wash your hands frequently with soap and water or with an alcohol-based hand sanitizer. Cover your nose and mouth when coughing or sneezing with a tissue. Throw away, then wash hands immediately. Avoid close contact with anyone who has the cold or flu-like symptoms. If you become ill, please visit your doctor or nearest health center and share your travel history. A health and wellness message from your Ministry of Health.
And we're back.
And if you're joining us right now, we're just getting our third conversation started. And we are speaking all about kidney disease and insurance. And we have with us Ana Cortez, who is an administrator from the Kidney Association of Belize. We also have Lynette Valerio, who is the acting president of the Belize Diabetes Association, and Derek Pereira, who is the public relations officer from Belize. Good morning.
Good morning, guys. Thanks for having us.
Good morning. And thank you for joining us. Of course, this is a very important topic that we are discussing. And perhaps, Derek, you can get us started talking all about this initiative by Belaifa.
Hi, good morning. Thank you very much. Annually, Belaifa celebrates the Insurance Awareness Week. And Insurance Awareness Week this year started November 22nd and runs up to November 28th. Traditionally, we celebrate it in October, but this year is a special year because of all that's happening, so we had a delay for a month. We're celebrating Insurance Week under the theme, Enriching Lives Through Financial Freedom. Together, we can make a difference. And our week started on Sunday with a church service that was held at the Sun Hill Methodist Protestant Church by Pastor Leal. And he gave a great service talking about Thanksgiving, which for the most part, is what we're all about, what we're trying to do. Both these associations, the kidney and diabetes, along with Belaifa, as much as possible, try to give back to our society. Continuing in the week, we will be having a food drive, and we normally partner with certain businesses. We're looking at Brody's and usually not bottom dollar, but Publix, which will be assisting us in putting out baskets so that persons can donate some canned foods that we usually would then pass on to the Liberty Children's Home. So we normally partner with Liberty every year to help out the children that they do assist throughout the community, and they are located in Ladyville. So in the week, we normally would have a fair, a health fair, that again, we will partner with Kidney. And the last day of the week is usually a gala that is held annually, usually at Biltmore or at Old Belize. Unfortunately, again, this year, because things are a bit different, we will not be having the gala. So we will be partnering with diabetes and we'll be partnering with kidney, and we will be doing a telethon. And so my other two colleagues that are here are going to help me in advertising this telethon to Belize for the first time.
All right, let's start with you, Anna.
Hi, good morning, and thank you for inviting me. Yes, this year, because what is happening worldwide, there has been a lot of changes for our activities. Therefore, we have partnered with Diabetes Association and Belaifa to do this telethon, which will happen next year. We are very excited. We are waiting to see the contributions that will be coming in from all the different sectors, the community, the business community, and our Belizean people on a whole, as to assist us with the donations. You know that our funds normally goes to assisting our renal failure patients. At the moment, we have the cases have been increasing every day. We have a new person being diagnosed with renal failure, and it's very sad because sometimes they don't have the funds to even start their dialysis, their treatments, and the association. We're very short of funds, I must say, but we still try to assist them as much as we could. We even try to assist the families, not monetary wise, but by giving them our support, our mental support, so that they could cope with what's coming for them.
Yeah, yeah. So, I mean, you both, the Diabetes Association and the Kidney Association, your work is so linked. Diabetes is looking at prevention and proper maintenance, and kidney is also looking at prevention and, of course, coping with kidney disease, whether it's chronic or temporary. But usually, if someone is not successful in maintaining their diabetes, then they can very well end up with chronic kidney problems and have to be on dialysis or need additional care that oftentimes is really expensive. So I say all of that to bring Derek back in. Insurance is something that many people see as a luxury, especially when you're talking about health insurance. Or people who have pre-existing conditions feel that they will never be able to qualify for. Where are we now in looking at being able to offer adequate health insurance to people who do have these types of conditions?
Thanks, Marlene. Well, definitely I can say that we have seen that health insurance applications has been on the rise since COVID has unfortunately reared its head. The decision in reference to offering coverages for persons that already have underlying conditions is one of the insurance companies. It's a business decision and it's based on risk. So unfortunately, as of right now, I know, for instance, one of the companies that are part of our association is looking at additional products that they can offer, but those have not been decided or rolled out as yet.
Yeah. Yeah, I mean, so my point is that there is oftentimes when people end up in these situations, they may not have the cover of, let's say, health insurance to help them through. And that's where associations like Diabetes Association, Kidney Association try to fill that gap. Ladies, tell us a bit about the support that you offer to people. Anna, you outlined that you try to help with the funds that you fundraise with helping kidney patients get the treatment they need. What about you guys at Diabetes Association? Lynette?
Yes, thanks, Marlene. So what the Belize group of insurance companies do, though, they also have a branch that supports wellness and healthy living. So they do get actively involved in doing healthy activities for the public. And that's the area that we support because we always want to be able to actively involve and engage community and people in participating in wellness. In the past, they would do 5K runs and have some health fairs that they actively support. And so it's that kind of collaboration that we at the Diabetes Association engage in because we want people to actively involve and to learn all about healthy living and lifestyles because those kind of lifestyles, practices, good healthy living will really delay the onset of diabetes and in turn will delay the onset of kidney failure. And so we actively support the area of healthy living, wellness activities, because that's where we can prevent diabetes and that's where we can prevent any further delay in failure, which as a result, diabetes always, in most cases, result in renal failure and other kidney diseases. So that's the area that we always support the organizations with.
Yeah. Now, looking at the idea of the challenge of raising funds in the time of a pandemic, or even being able to get the support that you usually get. How's it been going so far?
It has been very challenging for all the organizations to who normally would do different activities to raise funds. We know that some people are not working. They are, some are just working for days, and even ourselves, we're not working fully to see the public, but we are still trying. We, the little bit that comes in, we do appreciate it, and we thank the business community. We thank our Belizean people to still have that kind heart of donating. Once we come on the media, on the social media, there are so many ways that we could be working towards educating our people, and we have been doing so, and we have been receiving not much, not as before, but we have been receiving funds and no one again, and we have been trying to assist our patients as much as we could.
Okay.
And that's the reason, Marlene, why we decided to team up together to do the telethon, because if the associations here will be doing their own fundraising, they would be competing for the same amount of charitable donations from the communities.
Yeah.
So we decided, let's just team up together. Let's see how we can best raise the funds that we need to purchase the machine for the kidney patients, machines for testings at the Diabetes Association, and also for Belize to continue to do more wellness activities for the general public on a consistent basis. And that's the reason why we all felt that, we need to collaborate, because in that spirit, we would be able to achieve all the activities that we want to achieve, the fundraising, which in turn will lead into having more health and wellness activities for the public, get the machines that we need at the Diabetes Association to do testings for people, and also help those persons that Ms. Anna mentioned with their kidney costs and dialysis that we urgently need in the country. So that's the kind of collaboration that we want, and we will start the planning. Ms. Anna mentioned it will be the second Saturday in March 2021. So we're gonna have a series of activities to plan for this fundraising that we're really excited about in early March.
And you've given advance notice for people to know that it's coming up next March. Yeah. But let's talk about some of the other ways that this Insurance Week is being celebrated. And Derek, you gave us some insight there about increasing interest in health insurance. But overall, what is the status of how people now view getting policies for themselves?
Well, both of the ladies spoke about insurance. Sorry, not about insurance, but awareness. And awareness is very important because it's about education, and we try as best as possible to try to educate persons. Now we know in this particular time that we are going to see some persons not being able to continue paying for their policies because of certain circumstances, loss of job, or reduced income. So it's a continuous thing, Marlene, and we know that our culture in Belize is not necessarily one of insurance, and not one that was brought down from our parents to educate you about insurance. So it continues to be a work in progress to show people that the need is there. And as the ladies rightfully said, prevention is important, and there are certain persons that we would speak to, and when you talk about their family history, we'll see that those persons probably had a mother, an aunt, and sister, or somebody that had one of these illnesses. And so along with prevention, it's also to be proactive and to try to mitigate as best as possible. And this is where insurance comes in, because the possibility exists that in some cases, some persons will get it because it's hereditary. Yeah. And the possibility is there for you to get this coverage while you're younger, before any onset of the illness appears. Then you would be covered should in case something does occur.
Okay.
And how is it that you've been, in light of what you've been saying, that you know, it's a cultural thing that we've been, or that we're trying to combat. So, you know, do you have any message or that you would like to impart to let people know about what the importance is of getting insurance should in case something does happen?
Well, we like to use an analogy where we say, you know, if you're jumping out of a plane, you need to ensure that you have your parachute before you jump out, because, you know, you can't get it at that point in time once you've jumped. And, you know, and so the importance, the message really to persons is for them to look at their situation, look at what has just happened in terms of COVID. COVID started in December of 2019, and it reached Belize somewhere around maybe March of 2020. Yeah. And a lot of people didn't hear about it until maybe February or early March. And so it came technically without any warning. And this is the same way that certain things can occur, whether it is one of these illnesses that we advocate for or another illness. These things just occur. And so it's important for persons as best as possible to just consider all the possibilities that may occur. The purpose of insurance is to ensure that you have something that is going to create a fallback should in case something happened to you, whether it is that somebody died, and we've seen that, I didn't see the last statistics, I think probably 90-something persons has already died from COVID. So that those are breadwinners, those are parents, and so we'll have some orphans, you know, and we have some income missing from some households. And so those are all the things that insurance can help to replace. We always tell our clients, I mean, we really sympathize. We can't do anything to replace a life. The life is the most valuable thing. However, after life, life continues for the ones that remain, and having some financial fallback position is going to help as best as possible to try to mitigate some of those financial challenges that they will face through the continuance after that person has passed away.
Yeah. You know, when you imagine people who perhaps are diabetic or facing kidney problems at this time, it's a pretty frightful time for them. And so if you could speak to people this morning, you know, that are considered high risk and about proper maintenance and still keeping up that healthy lifestyle, what would you say to them? Let's start with you, Valeria.
For us, it's very important that people start becoming aware of the risk factors for diabetes. Yeah. And the risk factor is obesity and overweight. Yeah. And that's because it's because of our culture. We eat a lot of rice and beans, tortillas, corn, pasta. And so it needs to be that we have a change in our lifestyle, in our cultural practices, and the food that we eat and the portion size. So it starts with that. And we feel that more education in the primary schools and general education will really help in changing our eating habits, will help in practicing more exercise, get involved in more physical activity, but it really needs a mindset. And that's where, you know, we at the association, we try as much as possible during, you know, as our awareness campaign month, we go into primary schools so that we can educate the teachers about these type of factors that they need to do. And so we take it from there. We feel that prevention is really important in making sure that our children learn the importance of healthy living and eating habits. And, you know, it will delay diabetes.
Yeah.
And those are factors that we talk about.
And in keeping up with kidney health, of course, if you have diabetes, that's one part of it, keep it under control. But Anna, what do you say to people about staying healthy during this time?
We always recommend for them to control diabetes and hypertension, since that is the two main causes. And we also, as Ms. Valeria said, healthy eating and drinking a lot of fluid. Remember, we need to keep our bodies hydrated and reduce the consumption of salts. You know, we as a culture, as she rightly mentioned, we eat so many things that we shouldn't be eating as much. We need to cut down on those sugars, on those salty stuff, on those fatty foods. We need to include more fruits and veggies in our diets, and we need to start drinking a lot of water. That's the most important thing. We as a culture, we love our soft drinks, we love our sugary drinks, you know, but we could still have our drinks, natural juices without sugar if possible. You know, we could replace them with natural juices. We could drink more water instead. We could eat more fruits. But I mean, there are so many things we could do to prevent these diseases, or not to prevent them, but to prolong the process. You know, persons with diabetes, they could keep it under control, and that will prolong the process of they coming to end stage renal failure. So, you know, just keep everything under control. Remember to visit your doctors regularly and take your medication as prescribed by the doctors.
All right. Well, any other activities that people can join in on from Belize and Derek?
Unfortunately, no, Marlene, we have been very limited in terms of what we can do because of COVID. Even in reference to our food drive, we normally would have our advisors at these different locations where we would have our baskets and our signs. Unfortunately, because of COVID right now, we will have our baskets and we'll have our signs. We'll just do spot check-ins to see that persons are donating, and try to work with the different businesses where we leave these signs to try to encourage their staff to ask people to drop in a donation for us. Apart from the stores mentioned, we'll also be partnering with the different insurance companies, and we'll be leaving our baskets or a box with our sign at those locations as well, so that persons can drop in some canned goods. But for the most part, those are the activities that we will be doing. And so we're asking persons who normally contribute to us, and as you can see by some of those shots, it's anything that people will leave with us, as well as cash. And so we use those monies to help to buy maybe flour and stuff in bulk for us to donate. So we look forward to the great interaction. The Belizean people has always been very supportive, and we rally together to try to help persons in need. And so we look forward to that support, and we also will be counting on them for our telethon next year.
All right.
And Lynette, if somebody wants to contact the Belize Diabetes Association to assist with this or any other initiatives, how is the best way to get in contact with them, with you?
We are located on the corner of Mahogany Street and Central American Boulevard. Persons can find us on Facebook. Our office numbers are 203-3333 or 670-9239. They can find us on Facebook if they don't remember those numbers, and we're open from 8 to 4 o'clock p.m. We also do free testing for persons who would like to stop by to find what their glucose readings are, and we are available for counseling as well. If persons want counseling, they can call our office. We can set up an appointment for counseling. If persons also want to check their foot, we can also make appointment for those activities for persons. But we encourage people to exercise and really be mindful of their portion size. And if they do that, exercising 3 to 5 days per week, at least 10 minutes every day consistently, they should be in good shape. And we encourage people to really take care of their health. It's very important to delay the onset of diabetes, and in the end, delay the onset of kidney failure and all the disease that kidney diseases can bring up in a person.
All right. Well, thank you all for joining us this morning. That's a great reminder. We should go out and have a healthy breakfast, or drink some water at least, and keep that in mind as we know we're looking at what's happening with the pandemic. We still have to maintain a healthy lifestyle. All right, so we wish you the best of luck, and people can get additional information on your individual Facebook pages, and stay safe, please.
Thank you.
All right.
Thank you.
And with that, we're going to go ahead and take our final break. And when we come back, we'll have our wrap-up. So stay tuned.
In these challenging times, the one thing that is certain is that the Belize Bank Limited is here for you. There is nothing more important than your health and safety, and we continue to make every effort to make banking safer for you. Our staff is working around the clock to make sure you can do your banking conveniently 24/7 using our mobile banking app and online banking and keeping ATMs up and running. We value your relationship with us and are here to provide the support you need. First responders are also out there 24/7. Thank you, healthcare workers, security forces, firefighters, caregivers. You are all appreciated. Stay safe. We will get through this together. The Belize Bank, our country, your bank.
As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
With Smart's Loyalty Rewards program, you have tons of rewards waiting to be claimed just for using prepaid services. Now, let's get those rewards. But first, we need to download the Smart Belize app from Google Play or the Apple's App Store. Open the app and click Register. Then, click Get Activation Code. You'll receive an SMS. Now, enter your number and the code to activate the Smart app. Open the app and rewards are now accessible. In My Account homepage, you'll see how many stars you have and how many you've redeemed. To see a list of rewards available, just click the Go to Rewards button and let's start redeeming. With My Rewards, I'll redeem 140 stars for 1,000 megabytes of data for more TikTok uploads and 60 stars for 75 SMS. It's that easy. You can also get extra on uploads with your stars
by just clicking Activate, and the next time you put in credit, you'll get your reward.
So remember, just for making calls, texting, and using data, you get free reward points that you can redeem using the app, all from your fingertips.
Smart, bringing people together.
And we're back.
If you're joining us now, we're just wrapping up our show. We had a lot of interesting conversations this morning, and we want to say thank you to all of our guests for coming in. Of course, we were speaking in our first segment with two healthcare workers who were speaking about their experiences both at work and also both of them having been tested positive for COVID-19. They were sharing a bit of their experience that they went through while they were quarantining. And so we thank Simone and Nyla for coming in and sharing their perspectives as frontline workers who did test positive.
That's right. And we also want to thank Kevin from Red Americas to tell us a bit about the Youth Resilience Project that is going in Belize rural, in the rural communities of the Belize district. And definitely something that can be very beneficial both for the young people, but of course for the wider society or the wider community in having support networks for people who've experienced gender-based violence.
And finally, of course, we want to say a big thank you to our final guests, representatives from the Belize Diabetic Association, Kidney Association, and Belize, talking all about kidney diseases and the importance of staying healthy, as well as the importance of insurance, health insurance, that is in times like this. So thanks to all of the representatives who came in to discuss that this morning.
And with that, we're going to wrap up the show. Remember, if you want to contact us, send us an email at oye@channel5belize.com. You can also drop me a line at marlene_oye@channel5belize.com. Find us on Facebook at Open Your Eyes BZ.
And on Instagram at OIE Belize.
And remember to tune in tomorrow morning at 6:30 when you open your eyes.
Start your morning right.
Until then, keep your eyes, your mind,
and your heart open.
We'll see you soon. Enjoy your day, Belize.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.